What's up, beautiful people? Another day, another study. This was an interesting study because it aligns with a lot of what we do in preventative medicine. And one of my philosophies is aggressively looking at people's risks and then trying to mitigate those risks as much as possible. And of course, one of those factors that we look at are blood lipids. We've talked about LP little a before. We've talked about LDL-C before. We've talked about coronary artery calcium scans. This was an interesting study because they looked at people who had a coronary artery calcium score of 0, so no calcified plaque, and then looked at the risk of having non-calcified plaques via a CT scan, and then assessed LDL levels and the association there. And what was important about this study is in those who were young, between the ages of 18 and 45, even those who had a coronary artery score of 0, as LDL increased, there was a higher likelihood of having non-calcified plaques. And those non-calcified plaques were associated with higher risk of myocardial infarction and coronary heart disease. And I have all the breakpoints and data in the caption down below. But what I really wanted to talk about was I think it is important to take a more proactive approach. And we've seen a lot of people saying LDL doesn't matter and it can be high and there's no consequences. When you look at the data, it's a lifetime exposure. The higher your LDL is over the longer period of time, the higher your risk is for developing cardiovascular disease, atherosclerotic cardiovascular disease. Therefore, in people who are young, we really need to take a targeted and aggressive approach. And I'm not saying it has to be with medication. In fact, I prefer it start with lifestyle and dietary changes, see what happens with a lowering of LDL. If they have a coronary artery calcium scan, seeing what's going on there, and then getting a CCTA, which is the cardiac CT scan that can look at the arteries and look at the proportion of non-calcified plaque. So if you have elevated LDL, if you have elevated blood lipids and you're young, you should take that seriously because it's not something that, tomorrow you're likely to die of a heart attack, but the longer those stay elevated, the higher your risk is for the future. And it's much better to prevent heart disease before it happens than treat it after it happens.